Bacterial vaginosis. We want to understand what is bacterial vaginosis, science, treatment, and I have the right person here. Dr. Ganga, how are you?
I'm fine, how are you?
I'm very fine. Wewe uko na kidneys?
Kidney zangu ziko. Sijaingia ile mahali.
Be very careful out there. People are taking other people's kidney without their consent. But let's talk about BV. What is BV first of all, and who does it affect?
Now, BV is short form for bacterial vaginosis. It is a self-explanatory word which means that bacteria in the vagina.
Very nice. This bacterial vaginosis, how can I know I have it? As a woman, how can I know I have bacterial vaginosis? What are some of the signs?
First of all is the smell.
Okay.
If you find yourself smelling like a fish with a greenish discharge, then most likely you have bacterial vaginosis.
Very nice. I have seen these signs. What is the next thing I should do? What test should I do? Ndo nijue what to do.
Now, for bacterial vaginosis, you want to ask for two things. First, it is what you call a potassium hydroxide test or a POCUIF test.
Okay.
Whereby it magnifies the fishy odor or the fishy smell for the discharge. Okay. Secondly, is a slide for visualization. But you find that can actually get what you call cruisens, and that can actually confirm the diagnosis of bacterial vaginosis.
Very nice. Mtu amekuja. Now let's talk about treatment. The treatment is not for the patient. Treatment is for other people in this profession. So someone has bacterial vaginosis. First of all, does bacterial vaginosis affect fertility of a woman?
No, it doesn't affect the fertility of a woman per se. However, fertility is a topic whereby we want to know, are you even comfortable having sex when you have the discharge? So, are you even psychologically ready to have sex when you have such a discharge? Now, bacterial vaginosis basically, it just alters, it means that you normally have a bacteria in our vagina, and that mostly is what we call a lactobacillus acidophilus. That controls the acidity of the vagina. It means that other bacteria should not grow in the vagina. Now, so when the lactobacillus acidophilus goes down, then other bacteria actually multiply. So it means that insertion medication such as pessaries can actually help in bacterial vaginosis. That is one. Secondly, people who do things like doshing. What is doshing? Doshing is whereby you wash the inside of the vagina, and that alters the environment of the vagina. And when you alter the environment of the vagina, then you can actually get bacterial vaginosis. So it means that you want to clean the vulva that is outside, but you never touch inside. Bacterial vaginosis is not a sexually transmitted infection. Yes. However, having multiple partners increases the chances of actually getting bacterial vaginosis. Now, in terms of treatment, you have said pessaries, oral medication can actually help in terms of treatment of bacterial vaginosis.
Right. Now, other than medication, what other things, including in the medication, what other things can I take? Nasikia kuna vitu kama probiotics. What other things can I take to improve my healing process?
For bacterial vaginosis, those things, they actually don't work. Because, there is no way that the gut is connected to.
So you want to tell me probiotics has found kazi in treatment of me? You have said bacterial vaginosis is the change in the vagina. This me taking probiotics will not help improve the situation?
No, actually we have pessaries such as boric acid.
Okay.
That restores the acidity.
So you want to say, before we had the use of boric acid will help improve the vaginal environment?
Yes, boric acid usually, and because boric acid, the word says boric acid, and the vagina should be acidic so that other bacteria should not grow. So now when you use things like boric acid, it can actually help because it makes the ideal acidic environment of the vagina, hence preventing other yeast and bacterial vaginosis.
Okay.
Yeah, so things like probiotics, they are good for your gut. Trust me, they're good for your gut. And if you have a good gut, it means that the achievement is not directly per se.
Okay.
So look at it this way.
Uh-huh.
Things like estrogen and hormones can actually help prevent infections or yeast infections.
Okay.
And that's why most people who are pregnant end up having a recurrent yeast and candida infection because of change in hormones.
Okay.
When you have a good gut by taking prebiotics, then some of these hormones are manufactured by absorption of other vitamins and other things. So it means that it is for the general health rather than a direct cause of a healthy vagina.
Even taking water, because they are told, take a lot of water. A lot of water is going to help flush out the bacteria.
So now people confuse between vaginal infection and urinary tract infections.
Very nice. That's what you're going to talk about in the next video. Don't forget to share and subscribe.